Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune. Today I'm going to answer the question, what do pregnancy tests detect? So for you to understand, pregnancy tests are usually either blood tests or urine tests, and both of them try to measure the levels of a substance called beta human chorionic gonadotropin. It's basically a hormone which is present in both your blood and your urine, and it's only present in women if they are pregnant. So both these tests try to detect whether the levels of this substance or this hormone goes above a certain cutoff or threshold. When a woman is pregnant, the levels of this hormone rise tremendously. When a woman is not pregnant, the levels are usually less than 5. When she's pregnant, these levels rise almost every 48 hours. They keep doubling and they go into the thousands or the hundreds of thousands. So that's what these tests try to detect. So how is beta HCG hormone actually produced? So when the sperm and the egg unite, this sperm and the egg, once it unites, it creates something called the embryo. This embryo then attaches to your uterus through something called the placenta. This is just a tissue. It's like the joining or the junction between the embryo and the mother's body, and it's called the placenta. This placenta actually begins to make this beta HCG and it releases it into the mother's blood. Now, this beta HCG is initially present at very low levels, but as time goes by, it begins to increase in its level. Every 48 to 72 hours, the level of the beta HCG almost doubles in the mother's blood. This goes on for the first 10 to 12 weeks, after which the value stabilizes and stays pretty much constant or drops slightly towards the end of the pregnancy. So what do these blood tests or these urine tests detect regarding the beta HCG? How much can they detect? So for you to know, when a woman is not pregnant, the beta HCG level is usually less than 5, and most women it will be around 0. Once the beta HCG level starts to rise, most of the blood tests that are performed on modern machines, they can detect something even as low as 5 or even 6 MIU per ml of this beta HCG. And anything more than 5 is usually considered to be the cutoff for diagnosing a pregnancy in the very early stages. Blood tests are much more accurate. They are able to detect very low levels of beta HCG, and so they can detect the pregnancy as early as 8 to 10 days after conception. That is why we say that, even once you've missed your period, you can even start looking for doing this test on the second day after your missed period, or even on the first day after the missed period. The blood tests are capable of detecting the pregnancy. Urine tests can take longer because their thresholds for how much beta HCG they can detect are usually higher. They usually have thresholds like 20 to 25 MIU per ml of beta HCG, and for the beta HCG to reach that level, it will take around 4 to 5 days more. So for urine tests, we say it can take up to 14 days after conception, and for blood tests, we usually say it can take around 8 to 10 days after conception to detect the beta HCG.